Okay, next in line is Dr. Korf, who most of you know that Dr. Korf's at University of Alabama, and I think you might know that he came down from Harvard, from Boston, to Birmingham. He's probably got a few stories to tell about that. But what you may not know is that he'd gotten his PhD through the Rockefeller Institute, and before that he was at Cornell for undergrad as well as for his MD. And so he knows the streets of New York City. And one of my fondest memories, Bruce, was I think you'd already been in the NNFF, CTF at that time. And after an optic pathway tumor meeting, my mentor, John Carey, and Bruce Korf and I walked the streets of New York City smoking cigars. And I bet you don't do that very much anymore, but that's a fond memory that I think sort of brought me into the fold. So, Bruce.
Story Dave doesn't know, I don't think, maybe he does. John Carey and I were given tickets to a baseball game. It probably was that same night. It was just him and me that went. And we went to the stadium, and it's not rare if you go to these games that there's somebody sitting in your seat because they misread their seat number, and turns out they were one row ahead. And the thing that I'll never forget, I'm sure John would agree, was that person had neurofibromatosis. And I don't think he was there because of the meeting. It just was one out of 3,000 people in a baseball stadium, I guess, could be expected to be there that way. Anyway, I'm going to speak quickly, because I guess I have 10 minutes, about cutaneous neurofibromas. And I really have to say I'm showing slides that were provided to me by the person who's running the study that I'll be talking about, Ashley Cannon, who I'm sure would have loved to be here, except for the fact that she's having a baby this weekend. So I guess you'll agree that's an okay excuse. I don't think I need to introduce cutaneous neurofibromas to people in the room here. Most of you are familiar with them. But they are, by far the most visible manifestation of neurofibromatosis type 1 and really represent something that most every adult with NF1 experiences. And our question, and it follows very well from Brigitte's talk, was if selumetinib works for plexiform neurofibromas and achieves some degree of shrinkage, what about the cutaneous neurofibromas? Would those work as well? And most of the people, I think, treated originally on the selumetinib trial were younger and therefore didn't have very many cutaneous neurofibromas. And in fact, by recruiting people who are at an age where you would find them, we've created a study that is going to look at that very question. Before we could do it, we needed to be able to measure cutaneous neurofibromas. And you might think that would be pretty obvious and easy because you can see them. You don't need MRI and volumetric MRI and that sort of thing. The reality is it's harder to count and measure these than you might imagine, because the harder you look, the more you see, honestly. And trying to get a measurement of a fleshy nodule on the skin is actually not so straightforward. And when you start counting, no two people get quite the same numbers, and so it's a tricky sort of thing. We created these very low-tech paper frames that you see and have validated counts. We can get pretty good consistency if we make sure that we confine ourselves to tumors of a certain size and larger, 4 millimeters. So we did a longitudinal study where we had 22 people who participated, and actually now have been studied. It originally says 24 months and then 96 months, and this study actually continues and is pretty close to 10 years old now. So it's given us a chance to ask the question, how rapidly do cutaneous neurofibromas grow? So this is a very sensitive trigger here. So we have these data. I'm not going to show you all the fine details of the numbers here, but maybe the bottom line, which is actually, well, it's the top line, says about average monthly volume increase on the back was 0.3352 cubic millimeters. That's pretty tiny, okay? And so the main point about these, and this is something probably many of you will realize, is that measuring growth of cutaneous neurofibromas over time takes a long time because these do not grow very rapidly. Now, we don't have a lot of data about, is there a point in the lifetime of a neurofibroma when it suddenly grows and then it kind of stops growing and only changes slowly thereafter? And there's a variation in how fast these grew from individual to individual. The numbers were pretty similar on the abdomen and on an area of the arm or leg. Here are growth curves across the various people. And over a period of years, we could detect growth, but over a period of months, we usually couldn't, which is one reason why, thinking of a question asked a little bit ago, it isn't so easy to do a trial that says, does it slow the growth? Because the growth is pretty slow to begin with in most people. And let me just jump to here. This is an example of where over a period of 96 months, so quite a while, the arrows point to a few tumors that did grow during that time frame, and you can see just how slowly that growth was. I guess it's sort of like watching the hour hand of a clock move, and you don't see a lot. And again, if you come back a few minutes later, it looks pretty different. So that was a challenge, because if you're going to do a clinical trial over a meaningful period of time, which is usually measured in a matter of months, a year or two maybe, you can't necessarily expect to see a lot of change. So could I tell you that we put somebody on treatment and they didn't get any more cutaneous neurofibromas? Well, if 96 months and we see essentially nothing new anyway in a person, it's not going to be so easy. And you can't do a 96-month clinical trial. So that was one of the kind of challenging things. So these grow slowly, they do gradually accumulate, but it's over long periods of time. But nonetheless, we really thought that if selumetinib is showing activity with plexiform neurofibromas, what would happen if we treated individuals that have cutaneous neurofibromas? Now, for the reasons I just said, it's going to be hard for us to say that it prevents new ones from forming. Possibly it would, but it would take a long time to prove that. But the one thing we thought we could do is measure some of the bigger tumors and see if we can demonstrate shrinkage. So this is a trial which is at 2 sites, at UAB in Birmingham, and then also at the National Cancer Institute under Dr. Wiedemann. It involves recruitment of adults with NF1. The treatment will go on for 2 years, 24 cycles each, about a month, 28 days. And we're measuring the cutaneous neurofibromas. We're also doing some other things, some survey questions to see what the sort of effect on quality of life is, and some genomic studies as well. I won't go into great detail. But anyway, it's up and running. We've been enrolling people for now several months and are still actively enrolling. There are a lot of safety studies that have to be done because of potential toxicity of the selumetinib. It does require travel to one of the sites where the trial is actually being done. It's not the kind of thing that can be done remotely, especially because the measurements and counts of tumors is a fairly specialized thing. This is just to impress you with how complicated the genomic studies are, but there is some biopsy of tumors taking place, and we'll be looking at a variety of measures to see if we can find biological markers that help us to predict which tumors are likely to respond. There is also a study which will be launched soon, and I think soon means this summer, which is trying to assess patient views about cutaneous neurofibromas. So I'll tell you something that I find maybe just a little hard to believe, but maybe it'll make sense to you and maybe it won't, which is, we've had the experience of seeking funding for this, which it is funded, I'll say in a minute from where, and we occasionally get the review back, why would you bother treating cutaneous neurofibromas? It's not such a big deal, people live with them. Plexiforms that are compressing the airway, that people can understand, but we often get the comment back, it's not worth going on medication to treat cutaneous neurofibromas. Now, I find that a little hard to believe, treating adults who have cutaneous neurofibromas and seem pretty eager to figure out a way to get rid of them. Spread the word, because it's remarkable the degree to which researchers have viewed this as a not that important component of the phenotype, and I just find that really difficult. People don't die from their cutaneous neurofibromas, and it doesn't compress their airway. All the things that malignancies do or that plexiforms could do, but I think it does have an impact on quality of life, and we're going to be studying that to try to get some data. So I guess that's my 10 minutes, and just wanted to thank Ashley especially, who's really been doing the lion's share of the work here. Many other people, I won't try to name them all, Brigitte and Dominique at the NCI. The funding in part comes from the Neurofibromatosis Therapeutic Acceleration Project. Ashley is one of the Francis Collins Award awardees, and so they've supported a lot of her time and effort. And I guess I'll stop right there.
You did such a great job keeping within 10 minutes. We have some time for 2 or 3 questions if you want to ask them now. If not, you can wait till everyone's up on the panel.
Just wait for the microphone 1 sec.
Well, the question about measuring the size of neurofibromas and the cutaneous ones, is there a good method for doing that? I didn't quite catch whether you found a good solution or not.
We found a solution. I'm not sure I would say it's a good solution. The solution is we use those paper frames to define a region of the body, and that way we can, because you have to go back and count at frequent intervals, and you have to make sure you're counting in the same place. And it's, I wouldn't say easy, but it's possible to put the frame in the same place. You can actually use the neurofibromas, which don't change that much from month to month, as a landmark. So you take a photograph and you know that you're putting the frame in the same place. And a caliper is used. I didn't mention that, but that's how the measurements are done. And the precision of those measurements is probably not perfect, but it works pretty reasonably well. So it's very low tech. I will tell you that there are some other things going on using ultrasound and using a thing called optical coherence tomography as it's another very specialized and expensive approach to make measurements. And it may turn out that there'll be more automated measurements that are possible, but so far this has been a pretty inexpensive, low tech, but reasonable thing. The other point, which I think I didn't mention but should have, and here, it'd be interesting to hear how people feel about this. If you have a big plexiform neurofibroma and it's compressing your spine and it goes down by 20%, it may be just the 20% you need to relieve pressure on the spine and could make you substantially better, or the same could be said for the airway. I would hypothesize that a 20% reduction in the size of a skin neurofibroma would not be that noticeable. And if this doesn't work to make them dramatically and noticeably better, people are not going to be interested in going on medication and potentially having side effects for a 20% reduction in size that, to my mind, is probably not enough for a skin neurofibroma. So we need to do better. And whereas plexiforms, I think there's plenty of latitude because of the symptoms that they cause.
Well, 20% reduction would be a size of visible difference.
Hard
in
to
many
know,
cases.
actually, whether somebody would actually be able to see the difference in 20% or not. I guess a question we can ask.
Okay. Thank you, Bruce.
Okay.